Medicine has really evolved, and towards the 50s, there's a gentleman that was called Gibbons who discovered what we call the heart-lung machine. He developed that, and the heart-lung machine allows us to finally be able to operate on the heart so that we are able to stop the heart for a period of time. The heart-lung machine takes over the function of the heart during that time, and then we're able to operate on the heart. And once we are done, we slowly allow blood back into the heart and allow the heart to start doing its work. So it's one of those things that would really call a marvel of modern medicine. And so for us to operate on the heart, we stop the heart using special medications. Then the heart-lung machine takes over, and for that duration, we operate on the heart. Sometimes it's the valves that we are repairing, or it might be the valve that we are replacing, or it might be the coronaries that we are doing a bypass, or maybe it's a hole in the heart that we are fixing. After we are done fixing that, then slowly we allow the heart to take over and do its function. The way God made us, once we start allowing warm blood into the heart automatically starts to beat again. After a heart operation, somebody would need to be taken to the ICU for a period of time. Usually it's about 48 hours in the ICU, just monitoring that we do to ensure that someone is doing very well, that the heart has picked up its functions. Sometimes there can be a bit of abnormal rhythms that form, so we need to be able to quickly diagnose those and deal with those. Then after that, someone goes back to the ward, and in another about 3 to 4 days, they're able to go home. After the operations, a lot of what happens depends on the nature of surgery that we did. If, for example, we were replacing a heart valve, there's certain special medications that we give. We call them blood thinner medications to prevent any clots from forming on that mechanical heart valve. If somebody has gotten a bypass, for example, there are certain medications that we give just to prevent any, again, clots forming in the bypass vessels. And so a lot of what happens after the operation is dependent on the nature or the indication of the operation in the first place. What is most fulfilling about what we do is that we are able to change people's quality of life, and we're also able to give people serious longevity, especially when we're dealing with children with congenital heart problems. It's very fulfilling for me because I know their lifespan would have been probably less than 10 years. Then because of the intervention that we do, they're able to have a normal life. They're able to go to school, they're able to do life as usual. They'll be productive members of society. Families that would lose their loved one, maybe a breadwinner, and we're able to do some intervention, and then they're able to have this person with them, essentially doing life together. Those things are very fulfilling for us. Beyond just the care that we are doing for our patients, we're able to do training for the teams so that we have more and more people that know what it takes to do a successful heart operation on an individual. And I think this is something that we really need in this part of the world.